This patient had coloboma of iris, coloboma of choroid. Before taking up the operations, the patient had undergone anchoring laser. After usual incision, we used viscoelastic and did capsulotomy very carefully. There was a coloboma of lens in the lower quadrant and deficient sensory ligaments. The capsulexis was done very carefully, and we made it a point to leave a little more space in the lower quadrant. Two stab incisions were given to accommodate capsular hook. Since the capsule is filled with nucleus, it is not always easy to hook the capsule. We put just 2 hooks at the areas where the suspensory ligament were deficient. After the capsular hook were put, we made a stab incision as a side port, which very minimal hydrodissection. We rotated the lens to make it free from the capsule. Phacoemulsification was performed, taking care that we do not stretch the zonules where it's already deficient. We avoided to go to much periphery of the lens. And once there was one full chop, it was much easier to remove the nucleus. After the phacoemulsification, one very tiny particle of nucleus was left. It was hard to decide whether to do the phacoemulsification again or to remove it with the help of irrigation aspiration cannula. We took the help of irrigation aspiration cannula and were able to remove this small nuclear particle. you always have a danger to damage the diaphragm membrane at this particular area. After removing that tiny particle of nucleus, a thorough irrigation aspiration was done. It was always started from 12 o'clock position, and the deficient zonal ligament area was tackled in the last. The bimanual irrigation aspiration is a boon. After that, we injected high viscosity viscoelastic and CTR was put. You could inject this with the CTR injector. I prefer to use forceps because you can give direction to the CTR. The bigger chunk of anterior capsule left behind is not going to be useful. We use the hook in the left hand and we insert this hook into the capsular bag. Sometimes you need another instrument to disengage the hook. The capsular hook were removed. The intraocular lens was injected. In this case, there was a vitreous thrust all the time. The lens was properly centered. The viscoelastic were removed by irrigation aspiration. And air was injected to see that all the viscoelastics have been removed. And the patient had 6/12 vision. Thank you.